Veronica and my platform is called Med-ePharma. Imagine having a medical emergency, needing medications urgently, but you physically cannot leave your home. For thousands of Ghanaians, older adults, persons with mobility issues, and rural residents, this is their daily reality. Busy professionals struggle to find time for hospital visits, and even health-conscious individuals face long queues and limited access to pharmacies. This is the healthcare gap Med-ePharma seeks to solve. Med-ePharma is basically a digital health platform that provides access to safe, affordable medicine and teleconsultation across Ghana. So we allow users to have access to secure medications and also to book appointments online with physicians. And for our mission, our vision is to become Ghana's leading integrated digital health platform, making quality healthcare and genuine medication accessible to every individual, irrespective of your location or your physical ability. And our mission is to leverage technology to bridge the great critical gap in Ghana's healthcare system by connecting patients directly to certified pharmaceutical suppliers and licensed physicians. And for our key stakeholders, we have our users who are patients and caregivers. They don't necessarily have to be patient, but everyone can hop on the platform. And we also have pharmacists who are licensed medication suppliers. We have healthcare professionals who are our physicians, our doctors, and our specialists. And we have regulators, which is the FDA, the Pharmacy Council, among others. And we also have our logistic partners who are the Bolt, Yango, Uber Global, etc. And we have our tech partners, which is Zoom, Paystack, and we are also planning to implement cloud and messaging services. And we have our investors, which is ADF and other impact partners, and we have our internal team, which is the internal team of Med-ePharma. For our stakeholder influence interest matrix, for users with low influence, high interest, we keep them satisfied, and these are individual pharmaceutical companies. And for users with high influence, high interest, we manage them closely. Those are the regulatory bodies, the investors and strategic funding partners. And also those with low interest and low influence, we monitor them, who are the general public who have not yet signed on the platform. And those with high influence, low interest, we keep them informed. And for our business model canvas, we have our key partners. Our key partners are our pharmaceutical companies, our hospitals, our logistics services. And for the key activities, we make our medication sales, we do teleconsultation, and also offer emergency services. And for our value proposition, we seek to secure integrated healthcare platform connecting patients, pharmacists, and doctors. And we also provide convenient, affordable access to genuine medications and licensed physician, and we also offer teleconsultation, as I said earlier. And for our customer relationship, we seek to have a personalized health account, subscription-based health account, which will be featured in our second year. And for the key resources, we have our technology infrastructure, we have our licensed physician and hospital partners, among others. And for our revenue stream, we've decided to take 0.5% transaction commission on medication sales, and also to take 0.5% telemedicine booking fee. And in our second year, we also do subscription-based health. And for the SWOT analysis, because of time, I will take you through the basic ones. For the SWOT analysis, we have our strengths against our opportunity and the strategies. For the strengths, we have integrated e-commerce and telemedicine platform offering both pharmaceutical sales and physician consultation in one platform. Our weakness is that we have limited brand recognition as a new entrant to the digital health ecosystem. And our opportunity is a rapid growth in Ghana's ecosystem and telehealth adoption post-COVID-19. And our possible threat is a possible entry of global telemedicine competitors into the Ghanaian market. And these are the strategies to combat our weaknesses. And for the delivery, we've decided to use third-party delivery, which is to use certified logistic providers like Bolt, Yango, Uber Rides, among others. So these deliveries will be GPS tracked in real time with cold chain protocols for temperature-sensitive medications. And for the payment processing, we will ensure that all payment transaction complies with Bank of Ghana and the PCI-DSS standards, guarantees secure and transparent payment processing. So our platform supports multiple payment channels such as mobile money, debit cards, and e-wallets using the Paystack API. And for the security, we uphold Med-ePharma. Due to the sensitive nature of the platform, we uphold strict data protection standards in line with Ghana Protection Act 2012 and the ISO 27001 guidelines. So we perform end-to-end encryption, two-factor authentication, and role-based access to safeguard our user data. And now to our financial projections. For our budget, in the first year, we will make use of $262,000, which we are hoping to get from the grants. And in the second year, which is our stabilization and growth year, we will also spend $177,000, and in all, by the end of our third year, we would have spent $601,000. And for the revenue stream, this is where our revenue come from. Our transaction commission, as I said earlier, is 0.5%. Our telemedicine booking fee is 0.5%. And our subscription base will also be featured in the second year. That's why the first year is 0. And we'll also do advertisement and brand promotion. We will do data insights and analytics services. For our net financial projection, you could see that in the first year we had a deficit, that's a negative net balance, but in the second and third year we were able to stand on our feet, and this suggests that Med-ePharma will be a profitable organization. This is the user workflow. This is how the user will navigate through the platform. Now to the demo. Welcome to Med-ePharma. If you want to know more about us, this is the About Us page. And if you want to get in touch with us, here are our details, our phone number, and our social media platforms. So let's try and register a physician. Our physician is called Dr. Amasewa Owusu. Country is Ghana, and the city is Dodowa bus station. The phone number is 0549871234. And then it's pediatric. So now let's log in. I'm at gmail.com and our password. So this is the physician. This is the physician that will welcome Dr. Amasewa. Dr. Amasewa can make changes to her profile. So let's say she wants to add bonus to her name. Now let's try and update her profile. And now if you go to the dashboard, her profile is updated. And for now, she doesn't have any bookings, so her bookings are 0. So now let's log out. And let's go to our home page. Now let's try and register a pharmaceutical company. And the name of the pharmaceutical company is gmail.com. And here the hospital is in Lashipi, Tema, plot number 3, plot number 1, Lashipi, Tema. And the phone number is 08020. Alright. And the name is Mediza. Okay, let's complete our registration. The registration is complete. Let's try to log in. Nyako at Gmail, and our password is this. So let's try and then add medications. But first, let's add categories first. Yeah, so for the category, we have diagnostic device. So now our category is created, and then we can see it's a diagnostic device. But we can also delete category. And then let's go to the brands page. Now we want to add new brands. So we will have the brand name is Omron. I think Omron already exists, so let's say Microlife. So our brand has already been created. When we go to M, you should see MyPSC is Microlife. Alright, so now let's try and add medication. So now our category is diagnostic device. Our brand is Microlife. And then medication title. Let's do this first. It's a digital thermometer. It's 110.87 cedis. And then let's choose that thermometer. And to our description. This is our description and our keyword. Our keyword is here. we've already input our price. So now let's upload our medication. Yes, so now when you go to your medications page, you'll see your whatever you've uploaded here. All right, so let's log in. When you go to view all medications, you'll see your medication here. So now let's try and log in a user. Log out. Let's go to our home page. So now let's try and register a user. So our regular user is called Daniel Kwame Mensah. Daniel@gmail.com. And the country is Ghana. Adenta KFC 0248. Okay, so now let's log Daniel in. So now Daniel has been logged in successful, and then Daniel can go to his dashboard, and this is Daniel's dashboard. So far he has not made no appointment. So let's go to all products, where Daniel can actually view the products available. So these are the products Daniel can view, and then Daniel can filter by, let's say, acid. Okay, let's choose a different. Yeah, so when we have anti-acid, he can filter by anti-acid. For the brands, he can filter by amoxicillin, we have amoxicillin, and he can also search by name, osteocare. Yes, and this is our osteocare. So now let's click, and he can also go by the prices. So from this is the lowest prices to the highest price. So he wants to purchase grams. So this is it, and then so these are all the information, the company's name, the category, and here you can decide to purchase two. So we have an AI assistant here who can help you with the medication side effects and other things. So let's add to carts. It has been added to carts. So when he goes to his cart, he can see it here. So now let's try and order. We choose Uber Rice. Let's proceed. Let's make our payments. Pay. Yeah, so this is the Paystack platform. Then you confirm payments. Yeah, so now payment has been confirmed. And then here he has made successful payment, so he can book with an Uber. Since he decided to use Uber, so here when you come, then you log in and you do your Uber bookings. So here, because our cart is empty, it's giving us an alert that we've already checked out, sorry. But he wants to book an appointment. So here is for if you need immediate medical attention. So let's book a new appointment. Let's book appointment with Okay, so let's contact a physician. So here for the physician page, if you need immediate medical attention, you can call the hospital. You can call hospitals. You have a dedicated hospital who will give you an immediate response. And if you need to come to the clinic, they will send an ambulance to your location. So you can either call, but if you are so sick that you can't talk, you can send them a message and they'll respond immediately. So now let's add our medical information. I have ulcer and I'm allergic to peanuts. And for the additional notes, I have headaches, and then I have lightheadedness. So now let me proceed. So let me book Dr. Amma, who is a pediatric. And for the date, we are going to choose, I want to go for it on Wednesday and around 9 a.m. Okay, so now after booking, it brings me to my platform where I see Dr. Ronel and Dr. Amma. So let me join the Zoom call. Let's say it's time and I want to join the Zoom call. So the Zoom actually comes, I can turn off my audio and video. All right. So now let's go back to our page and log out so that we could see it from Dr. Amma's side. So when we go to Dr. Amma's platform, we can go to book and Dr. Amma also has this meeting link. So Dr. Amma can also join the meeting as well when it's time. My video is messing up, so yes. Yeah, so Dr. Amma can decide to cancel the appointment. So Dr. Amma wants to cancel the appointment, so now no bookings here. So let's go back to the user page. So then when we go to our dashboard, yes, Daniel has gotten the notification that his appointment has been cancelled. And here, so now he has only one pending appointment. All right, so this is all about Med-ePharma and what we are made of. All right, thank you.